Well, now to the controversial hot-button issue over whether illegal immigrants should be included in health care reform. An estimated 12 million illegal immigrants are currently living in the United States, and it is estimated that 6.8 million of them have no health insurance. President Obama and House Speaker Nancy Pelosi have said illegal immigrants will not be covered in the reform bill. But there is still a lot of confusion about it, with several questions being raised at town halls across the country.
Some of the things that are in our current bill that I don't necessarily like, and you have addressed already. One of them was non-U.S. citizens' health care.
So illegals go to the emergency room. What's going to happen? They're going to be turned away?
No, they'll be treated the way they're treated now.
So who pays?
The question says, will illegals be able to take their coverage to their homeland?
Joining me now from Washington, D.C., Maria Teresa Kumar, the founding executive director of Voto Latino, and live from Pittsburgh, Dan Stein, president of the Federation for American Immigration Reform. It's good to have both of you with us. Maria, let me start with the numbers for a second. 12 million illegal immigrants in this country, 6.8 without health insurance. Where do the remaining 5.2 come into the play, and how do they get insurance?
Well, I think some of it is actually it's from their employer. But I think, to be clear, we have 12 million undocumented folks in this country. That's correct. 60% of them, though, that have come here to this country that overstay their visa. So there are folks that we can actually track. They've been vetted and so on and so forth. And the big bulk of the folks that you're talking about are also children. And so when we're talking about extending coverage, which both the president and Speaker Pelosi have both said that they will not be covered, and we have to take them for their word because it's not in their interest to ensure that undocumented workers are covered. However, Nancy, that said, the more people that are opted into paying into the system, the lower the premiums go down. It's almost kind of like a Costco club membership. The more you buy in bulk, the cheaper your premiums.
Dan, if I see someone in the emergency room or in the office and I don't necessarily know his or her legal status, I don't have the moral nor the ethical will, I think, is the best term. But it's not within what a doctor does to deny care to people.
Well, look, the Hippocratic Oath says that you want to stabilize somebody in an emergency situation. Naturally, I mean, we can all agree that people in unforeseen emergent conditions need treatment, but that's not the issue. The issue is, are illegal aliens going to be in the public health care plan? And are taxpayers going to pay for health care for people with no right to be in the country?
But you know, there's no written word that in anything we've seen come out of Congress so far that says the answer would be yes.
Well, look, I've been working this issue for almost 30 years. The way that H.R. 3200 is drafted, this is the way it's drafted. Illegal aliens can qualify for the public plan. And the Congressional Hispanic Caucus is pushing to retain that language. And for the affordability credits for the subsidy, if one member of the family is here legally, then the entire family can qualify. And most importantly, there's no way to verify that eligibility standard. So the bottom line is, based on all these years of watching and experience at FAIR, we know illegal aliens under this bill will get health care.